Grow your practice, grow your wealth, grow your impact. Find out how to spend less time in the dental chair and more time on the things you love.
Welcome back to the Dental Wealth Podcast. With us in the studio today is always the one and only Eric Morin.
Good morning.
Good morning, good morning. And we have a special guest in attendance today. We have one of our really good friends, personal clients, Dr. Charlie Culp.
Hey, good morning, everybody.
Good morning. We're glad to have you. I know we've been going back and forth. We've been trying to get a perfect time for this to take place. So I know Eric and I yesterday we were talking about it. We were really excited to have you on. We know we got a lot of great stuff to talk about. Specifically, you're going to be doing this charity coming up. So we're going to raise some awareness around that. But before we even, really jump into any of that, just tell, the listeners more about you, where your practice is, and we'll start going from there.
Okay. Yeah, I've been jumped on with Tower Leadership probably a couple years ago. I'm from Rock Hill, South Carolina. That's where I've taken over the practice that my dad started about 40 years ago now. And so it's Culp Dental here in Rock Hill, general dentistry practice. And I think I'd be leaving something out if I didn't say that I have an identical twin brother who's an orthodontist, pediatric dentist in the area who works with another practice. But he'll be a part of the project that we talk about. So I definitely want to mention him as well. He's in the Charlotte Rock Hill area.
Shout out to Alex. There you go.
we had to give him a shout out.
Yeah.
Awesome. Yeah, I know you're in a great area. Your practice is, it's kicking butt and taking names. I know the other Dr. Culp, his practice is doing well as well. But the main purpose of us being on this podcast today is you guys are doing a community outreach. So I know one thing that Eric always stresses with, different doctors is ultimately you have to figure out a way to give back to the community. With a dental practice, you have the unique ability to do that. So tell us a little bit about your program, what it looks like, and how you guys are doing it, and what's the passion behind it.
Yeah, so always been kind of the back of the mind, like what can we do to give back? And, always do a little donation and all that kind of stuff here and there. But really kind of putting everything together and, kind of bringing our talents, what we've grown the practice to. It's like, hey, how do we use everything we've learned here to put something really cool together? And so that was kind of the impetus for it. One of the assistants kind of came up to me a couple months ago and was like, hey, what can we do for like dental health month for children and all that kind of thing? It's like, can we put a packet together that we give to these kids? I was like, we could do that. I was like, we don't know where these kids are, how to get in touch with them. I don't know what kind of the impact that would have. I was like, what if we tried to see these kids? And I was like, hold up a sec. Let me talk to my brother because he's the pediatric dentist and kind of knows a little bit about it. And so I called him, and within 5 seconds, he goes, yeah, I want to volunteer my whole team. Let's do a day. Let's make this thing happen. I was like, all right, it's moving then. I was like, so I always feel like I sign up for a lot of little projects. And so I had a lot going on at that point, but I was like, you're never too busy to jump in and do what feels right. And so, So I was like, all right, let's organize a day where we try to reach out and see as many kids as we possibly can that do not have access to dental care. And I was like, let's see everything that we can do in terms of the capacity that we've increased with our office, with the team and the systems that we have in place. Let's use those talents top to bottom to make this as effective as possible. And so, it's everything from, we're going to do marketing for this thing, which we've already done. We've already started booking patients for it. But we want it to be a full day and kind of test the limits of this place, see what this place can actually do with everything that we've learned and grown into. So it's just kind of, helping celebrate our success as well as kind of treating the community that I've grown up in. And it's cool to kind of feel that support. So my brother's going to bring his team. We're going to have our full team. We're going to, shut down everything and just focus on these kids. The schedule's already set up, and we've already started booking some of these kids. And so it's kind of exciting to see it come together. It is in June, so we still have time, but we're trying to kind of open it up slow to see what the need or the how everybody was kind of responding to it. Yeah. So now we're going to kind of open up the marketing even more, and we're going to expand out the schedule to really kind of we want to be overwhelmed with it. And so we're excited to try to make that happen.
That's awesome.
You know what I find that interesting is listening to the passion behind it. Because that's what every time I talk to you, the energy is always high, which I always love. and then when we started talking about something like this, it's interesting to listen to you talk about it, because I think sometimes this is done. It's like, well, we should probably do this every now and then, almost as an obligation. But I love the passion, and I love the idea of your brother jumping in, like, let's all go in. And it's starting from an idea of a team member who says, hey, look, let's do something different. Let's do, and then you guys you took a small idea and ran with it, right? And then now all of a sudden it's like, I'm gonna get my brother involved and he's gonna get his team involved. But I think one of the greatest things listening to you about this is just how much passion's going into this, like how much energy is going into this, how much joy is going into it. Because one of the things we're always talking about, as I always believe that it's great to have these practices, but we should do something amazing with them. And then it shows them, it's also great for the team as well to see that. So I love the passion and enthusiasm, just hearing your voice and the excitement. And I love the idea of it. Like, I can picture the phone call of you calling your brother. And it's like, let's do it, and you are all in on it. So I just think it's awesome.
Yeah, no, it was crazy. Like, because we want to see a minimum of 60 kids this day. And we had, like, the first day it opened up, the first day or two, we booked one kid for this day. And Alex and I were just so excited. We're like, dude, let's go out to dinner and get a glass of wine.
Right? You get super pumped.
We celebrated the one kid. And so we're excited to watch this thing play out. I mean, it's just, you put something in motion, then you kind of see what happens. And so it's a whole lot of fun kind of watching this all come together.
What made you guys go this direction as far as community outreach? Is there like a driving passion behind it?
Well, yeah. So Alex, so we worked with our dad after dental school for a couple years. Then Alex had the itch to go back to school, and so he went back and did pediatric dentistry at the Children's National Hospital in DC. And so, but then immediately finished up that program, he went right into orthodontics. So he doesn't practice that much pediatric dentistry, if any, unless he's filling in for one of their little projects that they have with their group. And so I think that's something that he has a real talent for. He has a talent for that I admit that he's really pretty exceptional with it. And so he didn't really get to do much of that. And so I was like, all right, let's get your talents in here and really kind of put them to use. And we're a general dentistry practice, and since the practice has been around for about 40 years, we don't do as much with pediatric dentistry. And so it's like, okay, let's kind of get out of our comfort zone, and we can have a bigger impact with that. And looking at some statistics in York County, where we are, I mean, there's over 7,000 children that don't have dental insurance, dental access care, and things like that, just from conservative numbers. And so it's like, okay, there's a need, there's an impact. Let's see what we can do.
Let me ask you a question. How's the team responding to this overall right now? Like, how are they acting around it?
Yeah, well, they're excited now. Initially, because everybody's been a part of like a Give Kids a Smile and all that kind of stuff, and I think a lot of their experience was with some of those events was that it wasn't well organized. It was more of hey, let's do a coloring book, teach them how to brush and then move on. And so, but here when my thing was like, if we're going to do this, it's going to be incredibly organized. Like I reworked the registration forms from that, reworked their schedule for that day, all this kind of stuff. So that way it's booked correctly. We can efficiently bring these people in. So that way it's not an administrative burden and we can maximize it. And so, one of the few requirements that we have of this is that they have to fill out their registration forms beforehand. So that way it's an event that runs smoothly. And so once there was a little bit of a vision that was shown, I think that really brought everybody together. And everybody's been excited since then, because when we first started talking about it, I guess it was November or December. And I was like, well, we gotta get some time, because we gotta put the plan together. It's not like we're just kind of rolling in one day and was like, hey, we're going to see some kids. And,
it takes a little bit of work to put on an event, doesn't it?
yeah, absolutely. And so it's 3 months of preparation before we even allowed someone to book. But now it's a website. They can sign up online. The whole marketing company, Market Hardware has jumped in and really kind of, they've been excited about it too. And so
this podcast is sponsored by Market Hardware. No, I'm just kidding. That's awesome.
But now it's full go. And I mean, every time I see somebody from,
what's the name of the website?
It's projectlittlesmiles.com.
Projectlittlesmiles.com. Reese, make a note to have this come up on the screen, please. Projectsmiles.com. There you go.
Little Smiles.
Projectlittlesmiles.com. Yeah. And so, we bought the URL. And so we do, if this goes well, it won't be a one-time off event. And so there's a lot riding on this thing going smoothly. And so we put all the homework in. So we want to be able to use this again in the future.
So let me ask you that question. Actually, I had written that down as a note because I wonder, as you're building this 3 months of preparation, which, by the way, I want to ask a little bit about that preparation. And this is because there are companies that put this stuff together, but you guys are doing this as a passion project, which is what I love. I love that you guys are saying, look, we're going to do this ourselves. We're going to invest in marketing dollars. We're going to put our talents and resources. We're going to make sure before we even take on a patient that this thing is set up correctly, which I absolutely think is amazing. But you said if it goes well. What is going well? So what would make this go well?
What would make it go well is that we see a minimum number of patients. I think we need to see at least 40 to make that a success. And when you're giving out free care, I think that there'll be a higher no-show rate with all that. So we have to plan for that. And so I think seeing a minimum number, but then teamwork, be able to bring in the team from Alex's side and my side of things, having everybody work together for a common goal. That would be exciting. And really just kind of proving that with everything that we've done and all the growth that we have, I mean, that's pushing the limits of our facility. I mean, we could not have done this 5 years ago. We just didn't have what it took. Couldn't have done it a year ago. We didn't have what it took then, but now we do. And so, all those little things playing a factor will make this a success.
All right. So what's the pre-huddle between the two teams? What is that? What does that sound like? What's the pre-huddle?
Well, it's the clinical side of things will be handled by my team. And so they do this every day. From the seeing children prophies and things like that, we can get through a child exam, but I mean, Alex's team, whether it's going to grab the Chick-fil-A for lunch, whether it's running around with these intraoral sensors to making sure everybody can take the radiographs, it's making sure that the correct kid is going to the correct room. And so it's, delegating some of those duties and making sure that my team focuses on the clinical side of things, just because, we're used to the facility and the workflow and the systems and all that.
Being where you're at now, let's say a doctor's listening to this and thinking, I love this. I want to do something like this. And maybe I should join forces with another office. Yeah. Is it easier because you guys are brothers, or do you think two dentists could get together and do something like this? I
think absolutely anybody could do that. And I mean, tell somebody to send me an email. I'll send them everything I've worked for. They can have all of it. And, and so, we're advocates for trying to do good. But I think anybody that just has just an idea of wanting to help somebody out. My dad had actually teamed up with a local dentist years ago before I even probably thought about dental school. And I always thought that was a little inspiring. I don't know how the day went or what they actually did, their impact that was made. But I mean, just even the thought of him teaming up with another buddy down the street, just really, really always kind of something I thought about.
What kind of things go? So you said 3 months of preparation. What are some of the big items that had to go into that? So we said marketing. You had to kind of put together a website or a landing page. What else kind of went into that? The 3 months.
The landing page. So we have to make sure for the staffing side to make sure that we have somebody, whether it's running the pan machine, whether it's setting up enough hygienists and things like that. And we were going to use there in South Carolina, under a certain age, the assistants can do child profies, and so make sure that we're booking this correctly and we're not selling somebody or reserving somebody a spot that we can't honor. The big thing was reworking these registration forms in a consent that's signed before the patient's booked. So that way, when we're seeing potentially 60 new patients or more, that we have consent to see these 12-year-olds that are coming in and sitting down in our chair, and that we're allowed to do all the treatment that we intend on doing. That was a big part of it, and really trying to, because it's different when we turn to, okay, how far out are we going to confirm these appointments? How far out? When are we going to make sure that the registration forms have to be done, and really kind of getting the team together? So it was monthly meetings with a little core group that we were helping organize this, and just kind of, and then with the marketing thing, those people were tremendous. I mean, it's giving out press release and all that kind of stuff to local news. I did an interview for that yesterday, which is not my comfort zone, but we got through it. They said they could edit it well.
That's what Reese does for us too, by the way.
I mean, I know how to do dentistry. I'm pretty decent at that. And so it was really just thinking outside looking in. It's like, all right, we got the dentistry part. How do we create this event? It's like, and we've done marketing something new for us over the last couple of years. And so that was really market driven on in, because a lot of the problems with these children having access to care is the same problem we're seeing with us getting in touch with them. We don't have access to them. And so the marketing was the biggest part of getting everything in place and then figuring how to roll that out. I mean, if we say we're going to see everybody for free, then we're going to be overwhelmed. That's why we had to plan to roll it out just a little bit at a time. It's just thinking about all those little nuances of it, and making sure that we're just setting ourselves up for success. And so we're still figuring it out. I mean, we're 4 months out on it. And so it's fun just to watch those little tweaks that we're doing along the way kind of pay out for us.
Does having this event in the future, so it's in June, does this get you more inspired day to day, like knowing that it's out there, like, because there's this event coming, right? So like, does that affect I guess is what I'm saying is, does this affect you daily? Do you is that in the back of your mind, and it's that future impact is is it a motivating factor?
It's awesome. And so like, sometimes you have some stressful cases during the day and things like that, but then when I come down and sit in front of the computer, and we had 2 people that signed up as a lead for this event. 2 people signed up for our event, and I mean, that's just fun. It just creates perspective, honestly. Yeah. And I mean, there's like a buzz around the office. It's like, hey, we booked another one. It's the little thing. It's just really, really cool.
It becomes a ticker at this point. We're like, at the end of the day, you get the stat sheet out and you're like, yeah, we had 5 more, we had 6 more, we had 4 more. And then eventually it's like, you have to cap it. And you're like, we can't see that many people. We have to do something here.
Yeah, I had a team member come up to me yesterday, and she goes, I checked the schedule for that day way too much. So I checked it 4 times a day to see what's happening. So.
Oh my gosh! So they're in. So do you have like a project lead? Are you leading this, or is there somebody? I mean, are you and your brother leading it, or is there?
It's pretty much. I'm kind of leading it here, but there's 2 team members, a hygienist and assistant, that help create ideas. Which it was really the foundational stuff, putting that down, which was tremendous. Because the stuff I don't think about from a clinical side, I was like, hey, we need more autoclaves and stuff like that. Like, no, you don't. And
did your team members jump in to help, or was it like you had a meeting and then how did that process work? How did you,
from the suggestion of let's try to do something for, like, create a packet for these kids, then I was like, hey, let's see if we can see these kids. I mean, and then talking to our brother, it was probably 15, 20 minutes. We were like, all right, we're all in. We're doing this. It was literally that quick. So
I think this is the first time, one of the reasons why we asked you to come on this podcast and talk about this is because of the enthusiasm behind it. I people do these events, but oftentimes it's like, we should do one of these events, and I'm not against that. Look, it's better to do it that way than not do it, right? So I'm not against that at all. I mean, I think anytime you help somebody in the community is huge, and I think that's great. I think what caught me was, I mean, Jordan called me up, by the way, the first time he talked to you, and he was just, for those of you who don't know, Jordan's an advisor here at Tower Leadership. He called me up and he just, we got to get Dr. Culp on. He was so excited. He's like, he's doing this thing. He's so excited. And man, this is like what it's all about, Eric. And he was like, this is what we talk about. We tell him to impact and do all these things. And he called me up from your energy, and he was like lit. I mean, he was just like, he was on fire. He was like, Dr. Culp's the man. And he was so excited about that. I mean, in that conversation, because he could tell that energy coming through, right? That passion, because that can be felt through the office, and everyone feels that energy, and so it's exciting to think about it from that perspective, which is really this idea of a passion project, because this is a passion project, right? I mean, that's what it is. This is not to check mark a box or anything like that. This is a true passion project, which, it does inspire the growth of the practice. It does inspire team members in enjoying being there. It doesn't, it does impact the community. To me, this is why we're all there, and everything else falls into place when we go towards these things. So I think it's an amazing thing. And the fact that you have a landing page set up and you're promoting it, you're
actually marketing it. Wow.
Yeah, I know. I was thinking to myself,
for it, all this stuff.
I mean, some people have a hard time marketing for their practice, so they're like marketing for
the charity
giveaway. It's like, so depending on where someone's at listening to this, yes, you should not only market as we talk about, but you should market. This is the next level, right? So now you've got a great. You found a great partner in your marketing efforts. That's been a great partner who's assisted you greatly. And then now that you have that partner, you're utilizing those results that you've gotten to impact this campaign, which is amazing because it's a campaign. I'm excited to hear about how it goes. I'd love to hear. Once it's done, we'd love to have you back on and kind of share the story, because here's what's going to happen is people are going, by the way, this website, they're going to just blow up this website. So I hope it's got
Good.
servers on it. So they're going to want to know all the details. I was thinking as you were talking, I was like, this is all fact finders listening, right? So it was like, they want the details. But I think that's great, and I appreciate you be willing to help, and take a look at his landing page, take a look at what he's done. I think that's why you're here, right? Is also to promote, it's to talk about, it's to share, because we're all a community. Especially the dental community is such a tight community, and I think that this is such an amazing thing to do. So. Go on his website, go check out the landing page, see what that looks like. And I think you guys are going to have a very, 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 very successful event. That's about your numbers. It's like you're going to blow by it, but I think that's great, right?
I think we should blow by them, but that's. So yeah, we're going to get there.
Well, you're going to have a capacity issue for sure. Where do we put all these patients?
That's what we're hoping on. Yeah, our 10th op will be outfitted before this thing, and so we're gonna see what this place will
nice. So one last time, what is the date on this? What's the name of the landing page so the listeners can go view it, see what you guys are doing, and then we'll close it up.
Yeah, it's Thursday, June 16th. I'll start seeing people at 8 a.m. until close, and they have to pre-register on. projectlittlesmiles.com, and it's pretty self-explanatory. Once you get there, it talks about the event and what's offered and all that kind of stuff. So just tell as many people as you know that are in need for dental care to fill that out, and we'll reach out to them and try to get them on our book.
Awesome. Well, thank you so much for joining us. Listeners, go to that website, check them out. It's a great thing to start doing. If you guys haven't started doing charities yet, this is the one and only. This is something that, we haven't seen someone take, a whole lot of effort into this like you guys are. And it's impressive. I'm excited to see what happens. As always, like and subscribe to the podcast. Thank you for joining us. Eric, thank you for joining us, Dr. Culp, and we'll see you guys next time.
Thank you.